Welcome to Herbally Yours, an adventure into the world of natural medicine. Here is your host, Dr. Ellen Kamai, the natural nurse who will help you take the leap to ultimate wellness.
Greetings, and thank you for joining me, Ellen Kamai, the natural nurse, for another edition of Herbally Yours, right here on the voice of Nassau Community College, 90.3 WHPC. Listen live on air or online at iHeartRadio, Odyssey, TuneIn app, smart speakers, or any podcast venue of your choice, or download our award-winning app at WHPC app. Thank you so much for joining us, because Herbally Yours brings you the latest information about the many facets in the world of natural living. Today, my guest will be Dr. Dorninger. He's a licensed acupuncturist and naturopathic physician, and he graduated from Bastyr University. Those of you who are aware of our show, we talk about Bastyr quite a bit since it's Dr. Zamperone's alma mater, and I would say certainly one of the top naturopathic universities in the country. Prior to medical school, Dr. Dorninger received his bachelor's in kinesiology from the University of Colorado in Boulder, and also finished his EMT training and volunteered at Porter Care Hospice in Denver. So this gave him a dual exposure of medical perspectives, which laid down the roots to his integrated approach to diagnosis, treatment, and healing. Thank you so much for joining us here on Herbally Yours today, Dr. Dorninger.
Thank you for having me. Glad to be here.
So can I also call you Dr. Eric?
You can. Okay. Call me Dr. E, Dr. D, Dr. Dorninger, Eric. Just don't call me late for a good dinner.
That's a pretty good way to put it. So you became a naturopathic physician after you were pretty well studied in conventional medicine. Why did you move over to naturopathic medicine?
Yeah, and I would say I never moved over. I just added on. So I had my own health crisis when I was young. And I'll spare you the details, but I went into massive arrhythmia. I dropped to my knees and prayed to God to keep me on this planet. And I saw a very conservative ER in Denison, Ohio. And I was very forthcoming with my history. And the nurse said, "Serves you right." Did a 180-degree turnoff and said, "The cardiologist will be in with you shortly." He had put leads on me, and I had a massive arrhythmia, but I did not show signs of dead heart tissue. And as we know, cardiac cells, once you lose them, we can lose you. And I asked him, I said, "Look, I'm at a turning point in my life, and I'm ready to really take charge of my health and treat my body as a temple, not an outhouse. What can I do?" And he said, "Don't drink, don't smoke, don't eat spicy foods." I said, "That's it?" And I'm giving you all the Dr. D gossip here. I was dating a dear friend of mine, Brigitte Mars, is a renowned herbalist in Boulder, Colorado, and I was dating her beautiful daughter, Rainbow Mars. And Rainbow and I had a lovely relationship, but went our separate ways. And I would hang out at Rainbow and Brigitte's house, and there was this whole wall of incredible books. I felt like Harry Potter at Hogwarts. And one was Chinese Doctor of Oriental Medicine doctors making diagnoses off the sole of your shoe, all the way up to the most hardcore biochemical constituents of botanical medicines, all the way up to, wilderness emergency medicine books. And I was just a kid in a candy store. And I decided that the experience I had in healthcare was okay, but there was a lot of room to grow. So I was explaining my version of what medicine could be to a platonic girlfriend, a friend of Rainbow's actually, Bonnie. And she said, "Oh, that's called naturopathic medicine. There's a school for that in Seattle, one in Portland, and one in Arizona." And I went on this thing called the Internet, and it had Bastyr, National College of Naturopathic Medicine, that's now called Nunham, National University of Naturopathic Medicine in Southwest down in Arizona. And it was their address and the telephone number. And I called from my swag bag of Go Naturopathic Medicine materials, and I was on the fence between Portland and Seattle. The winds blew me slightly north, and I started my journey through natural medicine. But the deeper spiritual philosophical combination there is I was a party captain my first couple of years of school, then was deep diving and needed to clean up some grades. And I asked people, what can I do to look responsible? And they said, volunteering hospice is pretty profound. And I did it to spruce up a resume. And it wound up being one of the most incredible experiences of my life, where during the day I was helping people die with dignity and less pain in hospice. And on the ambulance, I was doing everything in my power to make sure people didn't die. So it was quite a bipolar spectrum of medicine. But at the end of the day, it was Pam Schneider, Jared Zeff, Dr. Joe Pizzurno, Dr. William Mitchell, Les Griffith, some of those founders of Bastyr, who were sharing the principles of naturopathic medicine in a therapeutic order that made the most sense to me. And the number one tenet of naturopathic medicine in the therapeutic order is to identify and treat the underlying causes of illness, also known as remove obstacle to cure. And you have to say that in an old school, 1850s nature doc voice. But what we're saying is, when a headache comes into Roots and Branches Integrative Healthcare, there are 150 reasons for that headache bouncing around in my head. As simple as low vitamin D not binding serotonin, to a tooth abscess, to a water damaged building, to concussion history. And I have to look at all 150 of them, if I'm a true naturopath, to delineate the true underlying causes of not what you have, but why you have it.
Wow, that was a great explanation. And I'll tell you what, I know most of those people you mentioned, and they've all been on this show and all of our shows, which have been on since 1987, including Brigitte Mars and Dr. Joe Pizzurno and Dr. Mitchell when he was still on the Earth side. So we know a lot of the same people. I'm so surprised that our paths haven't crossed. But what a wonderful explanation about the fact that you seem to hit a dead end asking your conventional physician what's next, which I think is still a big complaint with many people. They're just, okay, given this drug, oh, that didn't cure yet? Well, then we have this drug, but that's about it. Eat healthy, they tell them. That's it.
That's it. And we're in a spiritual crisis right now, even in the holistic naturopathic community, where there's people who are becoming boutique kind of spa-like clinics with IVs and maybe saunas and supplement sales. And I have nothing against those, saunas, and those are step 3, stimulate the vital force. Targeted, lab-driven supplement loading is step 4, tonify systems. There's nothing wrong with that if you're still in hot pursuit of the underlying cause of that illness. And that's what Pam Schneider and Jared Zeff fought so hard for, is really establishing the therapeutic order. And as you're suggesting, I did go to Bastyr during the golden years, right? We still get Christmas cards from Alan and Beth Gaby. I still talk to Lise Alschuler on the regular. These are the people who did things right the first time for healthcare and for the patient population. And we're starting to abandon the most important step in all of healthcare, which is identify and treat underlying causes. You have to get what's kicking the patient in the shins out of the way for that innate healing to happen.
That's so true. And so that's something that you're still doing, and that you work with patients. And I guess you tend to draw patients that have chronic illness and autoimmune diseases that haven't been making progress.
Yes, and I think it's hard to not draw patients because over 50% of America now has a chronic illness. So if you're not drawing those, you're not paying attention, because you get that occasional person who comes in for their gyne exam, or, they have strep throat, and that's lovely. But the majority of Americans do not feel good. They have brain fog, they have fatigue, they're dealing with anxiety, they're dealing with depression, they're dealing with exercise intolerance. And a lot of the people who are doing these exciting new lifestyles that we would just call, Dr. Reekley, return to nature, sit in a booth naked and get some sun after you jumped into a cold lake, they're doing Wim Hof breathing. They're doing paleo, or they're doing carnivore, they're doing ketogenic, or they're doing healthy whole foods diet, but they're doing it so intensely to try and keep their headaches down. They're doing it so intensely to keep brain fog away. They're doing it so intensely to make sure that they can recover from workout. And I want to know, why are you so fatigued? There's many glory cases that we get to be a part of, and plenty of times we're getting our butt kicked in clinic and we're not seeing the results despite everyone working really hard, including the patient. And last year, one of the most exciting ones was a nurse who wanted to be an MP who had a headache for 9 years. They did a brain MRI. It was not a tumor. Schwarzenegger kindergarten cop, right? It's not a tumor, so what is it? He had a sensitive tooth, and his dentist told him to keep an eye on it. I said, heck no. 34%, 1/3 of all dental infection is missed on two-dimensional x-ray. A 2D x-ray is that panoramics you get. And, it just goes like this. So we sent him out for a 3D cone beam CT with written report, demand written reports from providers that take images. And that takes a 90-degree, a paper image, turns it 90 degrees and stacks. He had a tooth abscess. 4 hours after getting the tooth abscess out, his headaches of 9 years go away. 4 hours after getting his tooth abscess out.
Oh, yeah. We've seen those kinds of things all the time. Because we write quite a bit about many of those techniques in a book that Dr. Zamperin and I wrote called Arthritis, the Alternative Medicine Definitive Guide, which is a whole outline of naturopathic kinds of interventions and looking really deeply for the cause. So exactly right. And why isn't medicine just practiced that way? We have so many examples of where that is the way to go.
Yeah. And you said earlier, you kind of and I'm paraphrasing, but you abandoned conventional for naturopathic. And I see it all as medicine. And the exciting part of conventional is really the improved, validated labs and imaging. And I find that naturopathy has a lot of holistic fad labs that have not been clinically validated. And that's also a problem because we're spending patients' time, money, and energy ineffectively. An example of that would be urinary mycotoxins. When you pee in a cup and look for urinary mycotoxins, those are the same in healthy people as they are in sick patients. So what I just said is, urinary mycotoxins just tell you you've been exposed to mold. That could be from a planter's peanut or a moldy blueberry or an actual water damaged building house. And even if you're in that water damaged building house, it doesn't mean you're getting sick off it. That's called CIRS, chronic inflammatory response syndrome, where you don't have the right HLA, the right immune response genetics for mom or dad to clear that. So you trigger cytokine storms, self-made inflammation that burns your body down. That is evaluated with matrix metalloproteinase 9, complement 4A from National Jewish, TGF beta 1. So even in the world of naturopathic, we have these fad labs that kind of take hold and hostage of our diagnostic abilities. So our job as a naturopath needs to be calling the medical director, asking for clinical validation. Your job is to serve the chronically ill and graduate them and protect their time, money, and energy. So if I, from one naturopath to another, or from one naturopath to a medical doctor, I'm going to ask you, show me the studies where this test that you ordered separated sick patient underlying cause from healthy controls. And if you just say, hey, we're CLIA certified, and we just pipette things without flies and dust and dog poop in our lab, that's not good enough. We are so excited about modern diagnostics helping refine, identify, and treat underlying causes. But we're also getting polluted with fad labs that take our patients on a wild goose chase and waste precious time, money, and energy.
Wow, that's a really interesting perspective and something I haven't heard before, but really true. Because I did a lot of work with Vasant Lad at Columbia Presbyterian Medical Center, where we put together a traditional, and we use that word traditional to talk about ancient healing techniques. And he would, we did a double-blind study where we used all kinds of regular conventional labs at Columbia Presbyterian, and then Vasant Lad would do non-invasive, pre-symptomatic diagnostic ancient Ayurvedic techniques. And very inexpensively, he was really 98% the same information without very advanced new type of diagnostic tests. And it was just like smelling, pulse diagnosis, that kind of thing.
Well, and I'm really glad you brought that up, because physical exam is a lost art, and COVID is just stabbing that lost art in the chest. And what you have is experience. That's just someone who's done their reps, right? And when you look at 10 tongues and take 10 pulses in acupuncturist, you don't know your butt from your elbow yet. But you do 1,000 and you see things. You look at someone's color and you see things. That's not different than a good primary care. Like, we used to see this dinosaur of a pediatrician for our kids, and he would tell me things like, put steroid cream on my kid's cradle cap. As a naturopath, I know 100 ways to deal with cradle cap, non-topical steroid. However, if there was something infectious, this doc saw tens of thousands of kids over his 40-year career, had 4 boys of his own, and he's my guy because he did his reps. And that Ayurvedic provider you shared, they did their reps. And it reminds me of when I was in the IWC, the Immune Wellness Clinic, serving predominantly the gay male population of Seattle in my younger years. We had nothing for these men in conventional model and nothing for these men in naturopathic model. But the patterning, the yin deficiency of HIV pre-high quality antiretroviral drugs was so helpful to literally take 40 episodes a day. My hair just raised. I'm feeling the pain of feeling so inadequate during that time. 40 diarrheas a day down to 12 a day. And then they would hug me so tightly. I'd be like, what are you doing, dude? You're having 12 diarrheas a day. They were so grateful to have 28 less. And that was all because the Chinese medical model of pulse and tongue and herbalism and acupuncture at least saw the patterning. And now what Western biochemistry, when it's used well, does, it gives us even deeper details on things that Ayurveda and traditional Chinese medicine have been seeing for 5,000 years. And then there's new patterns that Huato and the whole group would have to pattern now, because they didn't have cell phones and EMFs and indoor living and, antibiotics and so on and so forth, for better and worse.
That's a great point. And I do want to remind our listeners that you're tuned into Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. And you can listen live or online at NCC Radio, iHeartRadio, or any other podcast venue. And you can always email us at whpc@ncc.edu. Today we have as our guest Dr. Eric Dorninger, and his website is DR and then DORNINGER. If you're listening in the car, don't write it down. We will have a live link on the archive, so just come back to the archive. Is there any other place that people can find you or your work, Dr. Dorninger?
Yeah, so drdorninger.com is basically where we host our website to access our clinic, Roots and Branches Integrated Healthcare. I write a lot about our perspective. We really take pride in grinding out the underlying causes of the chronically ill, of the mystery illness, and formulating a treatment plan that's based on why you have, not what you have, rather than trial and error medicine on both sides of the aisle. We host a podcast called The Vitality Hour. And if you just put Vitality Hour Dorninger, and it's not one that we're very consistent with, but I love episode 10, Dr. Eric Goodman on self biomechanics foundation training method. And episode 11 is Dr. Bill Blanchette, who taught me everything I know on how to prevent heart attack and stroke, still the number one killer of men and women. And then the other one is I'm on Instagram at Dr. Eric Dorninger, DRERIC What I do with my Instagram is I often post shyster shenanigans and charlatans in medicine on both sides of the aisle, and I do it politely. Today I'm going to post on lipophilic statins, fat-soluble statins, atorvastatin, also known as Lipitor, the number one prescribed drug in the United States of America every year, turns early mild cognitive impairment 2 to 3 times quicker into dementia than never using a statin.
I really think so too. Yeah.
Well, I don't have feelings.
But you're just showing the evidence. Yes.
Yeah, I'm an unemotional, apolitical, lean, mean, objective diagnosing machine. The reason I say that is because, of course, as a naturopath, you've seen clinically the problems with statins. What I'm saying is if you put into Google Journal of Nuclear Medicine, dementia, lipophilic statins, we have a hardcore paper on PET scans showing the memory centers of our brain no longer doing glucose uptake from statin taking. And it's a well-done clinical trial in a conventional journal. So I always tell, like when I get into these statin battles, there's a miracle prescription well call that we use in the Shoemaker protocol for dealing with SIRS and water damage building mold illness and Lyme and all that. That with flush niacin has a 90% reduction in heart attack and stroke. Statins on their best, they are 25%. So it's weird when they have good prescriptions in their formulary and they choose to use the trashy one that comes with tons of side effects and doesn't really do much for heart attack and stroke. And we tell patients all the time, one of the services we offer, we have 3 nurse practitioners and 2 NDs in our clinic. We're working on our 3rd ND, is there's 3 classes of drugs in our clinic. Miracle drugs, and these are true miracle drugs, right? I did a lot of, with Lynn Patrick, I did a lot of postdoc hepatitis C training, and we would just keep these livers alive. Now we have a miracle drug in Harvoni and the other class of drugs that eradicate hep C without much bad experience of the patient. They were using ribavirin and interferon for a year that would make you feel like chemotherapy. So that's a miracle drug, right? Well called cholestyramine for treating biotoxin illness is a miracle drug. Then there's rob Peter to pay Paul drugs, which basically help today but cause problems tomorrow. If I just sat in poison oak and my throat is closing and I need to do a prednisone taper in the ER, good idea. But I just threw off my hypothalamus pituitary adrenal axis because that prednisone shut down my brain's ability to signal with the adrenals. And I have to follow that pred taper with adaptogenic herbs, which aren't adrenal herbs. They are hypothalamus pituitary adrenal axis herbs. They are brain adrenal herbs to wake back up my circadian rhythms. And then there's trashy drugs, which we think should be off the market, but somehow pharma just gets to keep them on there, like lipophilic statins that are increasing mild cognitive impairment to dementia 2 to 3 times the rate that if you didn't do anything. So this is the healthcare system our patients and the public are up against. And one of the other things we like to do on the Instagram is just slay misinformation, try and educate. The root of doctor, docere means to teach. It doesn't mean to heal. I can teach you how to heal, and I have a little bit more training to sift through fads and fiction and papers so that we can guide people to spending time, money, and energy wisely on maintaining graceful aging.
So it sounds like you still have a very busy clinic that I imagine people can access physically or virtually.
Yeah, so my first love is patient care. I am a forever clinician, and even as we try and start making connections with big donors to help collect data to prove what we're doing, try and meet policy changers to say, why isn't insurance covering this? Those kind of important things to really mold a better healthcare system that solves problems rather than does disease management that's going to leave us all broke and unsatisfied. We grind every day, and I do 2 to 3 hard practice days a day where we grand round and do meetings and say, why isn't Mrs. Smith getting better? And at any given time, about 5 to 15% of our patient population, we have to put 5 heads together. And we also have nutrition staff that joins those meetings. And we say, what are we missing? And why aren't we seeing the momentum we usually see in this situation? But at the end of the day, the tail end of my career will be trying to influence improved access to healthcare that focuses on not what you have. Patient already knows that, but why you have it. And I've spent the last 7 years training understudies to pass the torch to so that you're not a one-man band doing cool stuff, right? I interact with classmates all the time. We just had Lori Mishley speak. I call her the Queen of Parkinson's, speak at SIRSX, our annual conference for biotoxin illness, sirsx.com. And she gave the keynote on everything she's doing with Parkinson's Camp, which is a 1-week camp at Bastyr, where she's following 3,000 Parkinson's patients on what works. Diet soda was bad. fresh vegetables, good. Frozen vegetables, neutral. Canned vegetables, very, very, very bad. Right? So she's able to pull these things out. Glutathione, helpful. CoQ10, helpful. Gluten-free, dairy-free, very helpful. Chicken, bad. Turkey, good. So very interesting things she's able to tease out. But the number one predictor of Parkinson's progression in her 3,000 Parkinson's patient tracking, active Parkinson's patients, is loneliness. The number one thing you should be addressing with an active Parkinson's patient if you want to slow their progression is loneliness. Now, again, I'm going for the underlying cause on top of dealing with loneliness. But if you don't have community as a Parkinson's patient, if you don't feel connected, even if you're in community, but you feel left out within that community, we got to fix that. We got to heal that. We got to support that, because that's the number one predictor of progression of your Parkinson's. So I try and really build communities that are working to heal the healthcare system from what you have to why you have it. But then, yes, one person, one patient at a time, we try and grind it out to the finish line every day at Roots and Branches.
Well, that's great, because I did that for 60 years, but I still do information sharing like this show, et cetera, but no more one-on-one. I did, so many thousands and thousands of patients over the years, and they're always asking me, where can I go? So we have a few people on our list, and I'm definitely going to add your clinic now, because I imagine you do also visit with people virtually or have your staff do so.
We do, and we also have many of the states licensed as well. So our providers, as COVID, telemedicine laws, if things kind of get restrictive again, we've instilled a plan to overcome that. Because sometimes you go to like the incredible neurologist at a Mayo or John Hopkins, and they're not doing much different than your local neurologist is. So we want to be able to pick that stuff up. Sometimes you go to Mayo Clinic and they're studying the most obscure genetic disease, and there's 12 of you on the entire planet. It's a phenomenal place to go get healthcare. So we try and pick up the people who are doctor hopping or haven't been anyone, but they're just suffering from chronic mystery illness and no one's getting them answers.
Well, I want to thank you so much for an absolutely fascinating show. You obviously have delved very deeply into all of these issues for many years, and we're talking to Dr. Eric Dorninger, naturopathic physician, licensed acupuncturist as well, and we have a link to his website, and you can find him on his Instagrams and other great places. And we did not even get to talk about, which we don't have any more time, but we'll do another show, because you have another big project, it looks like, in terms of blue sky CBD. So we'll just throw that out there, and people can look into that further. So thank you so much for being our guest today.
Thank you so much for having me.
And thank you, listeners, for tuning in once again to Herbally Yours, produced in the studios of 90.3 WHPC, Nassau Community College, Garden City, New York. For further information, email us at whpc@ncc.edu. This is your host, Ellen Kamai, at naturalnurse.com, inviting you to join us next week for another edition of Herbally Yours. Until then, stay healthy.